signing up for the operation.
Her father plays guitar and we do and stuff like that. So she comes over, she wants to get her guitar. And she'll, one day she'll have right hand.
Thank you so much for coming. This gathering has been sponsored by Move On, and it's also been co-sponsored by a variety of organizations, the AFL-CIO, the American Federation of County, State, and Municipal Employees, the Service Employee, True Majority, and Moms Working, and United States Action. And as you all know, we're here today to encourage, urge, exhort, and shame, if need be, our Congress into overriding the Bush veto. That veto denies millions of children health insurance coverage and access to care as a result of that. Bush and the Republicans are spending billions of dollars a week in Iraq, but are unwilling to take the steps that are needed to be taken to renew and to add to the health insurance coverage that are needed by the poor and the working poor and their children. A recent Washington Post ABC News poll showed that 72% of Americans support the bill that the Democratic Congress passed. 72%. 61% of Republicans support this bill, and yet it isn't happening. So the Senate, in fact, passed this bill with a veto-proof majority. So we just have to have our eyes on Congress. On Thursday, it will come back to a vote, and just need Republicans. If you have friends in other states, you could call them and say, please call your Republican congressperson and ask them to get on board with what this country is needing at this particular time.
This is from Grace B. from New Haven, Connecticut. She says, I'm 5 months pregnant. My husband and I each work 2 jobs, but none of them provide benefits. We are hovering just under 300% of the poverty level for a family of 3, living in an expensive state, Connecticut, where rent and utilities just keep going up. We're paying 20% of our income to maintain our own health coverage. Under the old rules, we would qualify for SCHIP through our state program and would receive good coverage for a $30 monthly premium plus copays. If SCHIP is cut back, we will no longer qualify, and when our baby is born, we will somehow have to come up with $2,000 to add him or her to our insurance. This is a serious hardship, but the alternative is for our child to have no health insurance and to miss basic preventive care and vaccinations. It infuriates me how stupid and short-sighted President Bush and the Republicans who have voted against this bill are to quibble over $35 billion while demanding 6 times that much for the war in Iraq, and to claim that hard-working families struggling to make ends meet somehow don't deserve affordable health coverage that will prevent much bigger and more expensive problems later. Congress needs to override Bush's veto.
I am an emergency room physician. We are the ones who care for the 47 million without health insurance, including many children. It is tragic to see families every day who are working hard but at jobs with no benefits and no health insurance. In emergency rooms, we can only put a Band-Aid on their problems. If these patients had insurance and could see a primary care doctor or preventative care, we'd save billions of dollars as a nation. Instead, the uninsured suffer while billions of dollars go to an irresponsible war in Iraq. Our country needs to restore our priorities, and that means Congress should override President Bush's veto of the children's health care. Brad C. in Circleville, Ohio.
My son was diagnosed with type 1 juvenile diabetes in 2003 at the age of 14. I'm a self-employed single mother and cannot afford to purchase health insurance for myself or my son. Luckily, as a veteran of the U.S. Navy, I receive free medical services for myself at my local VA clinic. but my income is not low enough to qualify for Medicaid to cover my son. Thank goodness I found out about Michigan's Children's Health Insurance Program, funded by the National Children's Health Insurance Program. I was able to enroll my son for only $5 a month, and all of his diabetes medications, supplies, and doctor visits are completely covered. Without this children's health program, the amount I would have to pay every month to keep my son alive would leave me bankrupt. Since I already work 60 hours a week and there are not enough hours left in a day which would allow me to earn more money, I simply would not be able to afford his crucial medications and supplies. The Children's Health Insurance Program has literally saved my son's life. Does our president not know that he holds the lives of thousands of children all across our country in his hands by way of his veto pen? I am sickened and ashamed of the direction our country has gone under this administration, and I implore the House and Senate to override Bush's criminal veto. Teresa D., Byron Center, Michigan.
Our 15-month-old baby girl is currently in the ICU in a children's hospital. She's been there for more than 2 weeks due to a rapidly spreading strep infection that led to septic shock. These have been the longest and more frightening days of our lives as parents. Thank God we did not delay seeking medical help due to financial considerations. The doctors and nurses say that if we had not been in the ER when certain symptoms appeared, it would have most likely been too late to save our baby's life. We are very lucky parents because we have good jobs and health insurance. The last thing we have to think about during this time has been our finances. It could have easily been different. As I pass by other rooms in the ICU and see all these very sick children getting such excellent care, it seems even more cruel that some children are denied access to the best our health care system has to offer. Even with health insurance, this crisis will cause some belt-tightening hardship for our family in the next few years, but it will not ruin us. Most importantly, we get to have our baby girl back. We count our blessings every moment for this. I am ashamed that our president would deny some children in our country access to the treatments that are saving my daughter's life simply because their parents are less well off financially than we are. It's time to treat all children in this nation as the treasures they are.
My family and I, we moved up to Port Townsend 3 years ago, and we came up here and we started farming. And we wanted to do that as a contribution in a way that we felt was really good to start farming. And so at that point, we could no longer afford health care insurance. And we chose as a family to just go without it. But at some point, we realized that we both needed to become employed again, and then we were looking for health care. And so both my husband and I are working presently, but neither one of us have jobs where we get any benefits. I have a temporary position at the hospital, and my husband's a teacher in a private school, and neither position offers benefits. And so my son and my daughter both are recipients of the DHSH program, and they receive just basic health coverage, and I'm very grateful for that. And so they've been on DHSH for about 6 months, and they've both seen the doctor and seen the dentist because of it.
So you must be pretty upset about this.
Yes, definitely. And my gosh, I mean, I even feel like for people who have it, you know, who really have children in the hospital or you know, have large medical bills. I mean, it's really appalling to me that our government is not allowing children to have access to health care. It's just eating away at our nation from the root up. And so I'm very affected. I'm going to write a letter.